Dear students, we are going to deal with the sixth model paper for the Kerala PSC exam for the upcoming post of Assistant Dental Surgeon 2025. So let's move on to the sixth model paper with question number 1. So please try to solve along with me the answers, and at the end of the question paper we'll be checking how many scores we have got. Okay, and if there is any error in marking the solutions, we'll just rectify them at the end of the video. So watch till end of the video and learn all the 100 questions in one go. Okay. Question number 1. The cortex of the lymph nodes contain options are cords of Billroth, Hessel's corpuscles, lymphatic nodules and white pulp. So the cortex of the lymph node contains mainly lymphatic nodules. Okay, option number C. Question number 2. The tongue muscles are developing from which option? Okay, from occipital myotome or first pharyngeal swelling, lateral lingual swelling or preoptic myotome muscles. The tongue muscles are mainly developing from the occipital myotome. Option A. Question number 3. Soft palate nerve supply. So just remember, there is a hard palate and behind you have the soft palate, and soft palate innervation is from 5th and the 10th cranial nerve. Okay, the trigeminal nerve and the 10th cranial nerve. Okay, so option B is the answer. Question number 4. Danger area of face is called because of the connection of the facial vein to the cavernous sinus through which vein? Okay, so there is a connection between facial vein to the cavernous sinus. The infection will transmit easily from the facial vein to cavernous sinus through transverse facial vein or superior ophthalmic vein or maxillary vein or ethmoidal vein. The answer is superior ophthalmic vein. Okay. Fifth question. Internal jugular vein is a continuation of common facial vein, external jugular vein, sigmoid sinus or superior petrosal sinus. Internal jugular vein is a continuation of sigmoid sinus. Okay. Question number 6. Which is true about multiple myeloma? In multiple myeloma disease, what is the option? Which option is correct? Whether there is a M spike, whether there is a direct plasma cell deposition in the glomerular capillaries leading to kidney damage. No, that statement is wrong. Interleukin 8 is the marker for bone lesion. No. Last question, last option, invariably increase in the alkaline phosphatase. No. So the first option, M spike increase, is correct. Okay. Question number 7. A patient with amenorrhea, short stature, less pubic hair can be in all of the following except. Okay, so the conditions are given except you have to choose 47XXY, 46XY, 45X and 46XY. Just remember, in case of 45 and 46, you have this particular conditions. Okay, amenorrhea, short stature and less pubic hair. In 47, you don't have. Okay, 47XXY, especially XSY, you don't have this particular conditions, clinical feature. Question number 8. The most common variety of soft tissue sarcoma is rhabdomyosarcoma, liposarcoma, malignant fibrous histiocytoma, synovial sarcoma. The most common type they are asking. The most common soft tissue sarcoma is malignant fibrous histiocytoma. Option C. Question number 9. The following are recognized causes of neutropenia except. Okay, so again except. So neutropenia is seen in typhoid fever. Neutropenia is seen in aplastic anemia. Neutropenia is seen in viral infection. It is not concerned with corticosteroid therapy. Okay, so option is the answer. Question number 10. Chicken wire appearances of enlarged bone marrow spaces is seen in fetal alcohol syndrome or sickle cell anemia or hemophilia A or beta thalassemia major. Chicken wire appearances of enlarged bone marrow spaces is seen in beta thalassemia major. Okay. Question number 11. In which segment of the nephron does tubular fluid has the highest osmolarity? Henle's loop or distal tube or proximal tube or collecting duct? In which part of the nephron there is high osmolarity? It is mainly in the Henle's loop area. Okay, option A. Question number 12. Which one of the following is a regulatory protein of the muscle? Regulatory protein of the muscle, troponin or myosin or actin or protein C. The one which regulatory protein is troponin. Okay. Question number 13. Function of Merkel cell, tactile sensation or melanophage or chemoreceptor or proprioception. A Merkel cell is always connected with the sensation, tactile sensation. Question number 14. Lymphocytes are located in each of the following tissues or organs except, okay, the one exception they are asking. Lymphocytes are seen in spleen. Lymphocytes are seen in lymph nodes. Of course, they are present in lymph nodes. Lymphocytes are present in thymus gland also. They are not present in brain. So option A is the answer. Question number 15. Neutrophil hypomotility syndrome is due to defect in the actin polymerization or deficiency of leukocyte integrins or defect in free radical production or absence of actin. So it is definitely concerned with actin. Neutrophil hypomotility is connected with actin. Okay, so either option A or option D. So their first option says a defect in actin. Okay, polymerization. Last option says absence of actin. So actin is present, but there is a defect in polymerization. That is why neutrophil hypomotility syndrome occur. So option A is the answer. Question number 16. Who proposed the trajectory theory of bone formation? Trajectory theory of bone formation was proposed by two scientists actually, Mayer and Kuhlmann. So Mayer is an anatomist, Kuhlmann is a mathematician. Option C is correct. Both A and B together proposed the theory, trajectory theory of bone formation. Question number 17. The scan index is generally used for what? For malocclusion or treatment need or treatment change or treatment of priority. So scanning is done whenever you need a treatment. Okay, so treatment change or treatment need. Treatment need. Whenever there is a need, you go for scanning. So treatment need index. Okay. Question number 18. Baker's anchorage is a intramaxillary or intermaxillary. That is the confusion. Okay, because anchorage is within maxilla or from maxilla to another region. Okay, so intramaxillary or intermaxillary. So it is intermaxillary. Okay, intermaxillary anchorage. Okay, clear. Next, question number 19. Guidance of eruption is another term for Frankel's appliance or activator or serial extraction bionator. Guidance to eruption is given in cases of mixed dentition period. Okay, in the mixed dentition period to children. So in children, for guiding the eruption, you do serial extraction. Okay, option C. Question number 20. Adam's clasp of premolar is made using the following diameter. Just by heart it, you have done in your preclinics. It is 0.7 mm diameter. Okay. Question number 21. Tertiary syphilis most frequently involves central nervous system or liver or testis or aorta. Tertiary syphilis, one of the feature is gamma. Okay, gamma. It is very painful ulcer type. And tertiary syphilis is also involving the central nervous system. Option A. Question number 22. Working end of Cryer elevator is placed at which region? So in surgery, whenever you do an extraction, Cryer's elevator, the working part of it is placed in which region? Junction of interseptal bone and mesobuccal portion of root, over the interradicular bone or distobuccal root, or between the teeth and the gingiva. It is placed in the radicular portion of the bone, interradicular bone area. So option B. Question number 23. Which of the following can be used as a local anesthetic agent for infiltration if a patient is allergic to amide and ester anesthetic derivative? So the patient is, you have to give the LA, but the patient is allergic to amide as well as ester derivative type of anesthetic drugs. So instead of that, you can give nitrous oxide or bupivacaine or phenylephrine or diphenhydramine. Okay, the best option to give is diphenhydramine. Okay, diphenhydramine. Question number 24. Long duration anesthesia is achieved by giving which combination? By giving 2% of lidocaine or 3% of mepivacaine or 4% of prilocaine or 0.5% of bupivacaine. Long duration anesthesia is achieved by giving 0.5% of bupivacaine with epinephrine, that is in the ratio 1:200. Okay. Question number 25. A swelling behind the ear suggesting which type of fracture? Zygomatic complex fracture or temporal bone fracture, orbital floor fracture or condylar fracture? Swelling behind the ear is suggesting of condylar fracture. Okay, it's just behind the condyle. So condylar fracture. Question number 26. The funnel-shaped perforations through wing-like retainers to enhance the resin restoration is a what type of bridge? Maryland bridge or Rochette bridge or Virginia bridge or none of the above? You must have seen the picture of this in the Prosto textbook. Funnel-shaped perforation through wing-like retainers are seen in Rochette bridge. Okay, option B. Question number 27. Disadvantage of using a stress breaker in a partial danger. If you use a stress breaker in a partial danger, the force will go down, okay, to the ridge. So what happens? The ridge resorption occurs. So option B is the answer. Option B. Okay, it is not, it is cumbersome or it is not economical. No disadvantages present. Disadvantages definitely there. It causes ridge resorption. Okay. Question number 28. In partial danger service, how many phases to fabricate a partial danger? How many phases is required? Okay, you definitely require 6 phases, okay, in a partial danger completion. You must have learned in the prostho. Question number 29. Food impaction under mandibular RPD is due to overextension or underextension. Whenever you do a underextension, food will definitely go inside, isn't it? So underextended flange. Question number 30. The preferred gingival finish line for a veneer metal restoration. Very easy question. For a metal restoration, not porcelain. They are not asking about porcelain. They are asking about veneer metal restoration. You go for chamfer. In the previous model paper, we had asked about the finish line for a porcelain jacket crown. That is shoulder. Okay. Here veneer metal restoration. That is chamfer. Coming on to 2081, when removing a rubber dam, the first step is to remove the clamp or release the holder or apply a water-soluble lubricant or cut the interceptal rubber with a scissor. So the best method to remove a rubber dam is to cut the interceptal rubber with the scissors. Okay, so option D is the answer. 32. Polycarboxylate cement is used temporary restoration or luting or permanent restoration or a dye material. Polycarboxylate cement is actually a luting material. Okay, option B. Question number 33. A radio opaque area is observed under a 3-month-old silver amalgam filling. The base under which most probably would be what? Okay, so you are seeing a radio opaque opacity. So white appearance will be seen under a silver amalgam filling. What is the base? It could be a calcium hydroxide. Okay, option A. 34. Cutting and grinding procedures are predominantly 2-directional or unidirectional or 3-directional or multi-directional. Cutting and grinding is a unidirectional procedure. Okay, cutting and grinding. Question number 35. For GV Black class 5 cavity, the retainer of choice will be, just by heart, for class 5 cavity, you give number 212. Okay, GV Black retainer used as number 212. Question number 36. The best sterilization technique for handpiece will be, handpieces are always autoclaved, isn't it? So question number 36A is the option. 37. Halo effect surrounding the root of a tooth on IUPA X-ray is seen with a horizontal root fracture, root caries, widening of the periodontal ligament space, periapical periostitis. So surrounding the root of the tooth in an IUPA, you are seeing what? Halo effect. Okay, it is mostly due to periapical periostitis. Question number 38. Gutta percha can effectively be sterilized by what method? Hot salt sterilizer, chemical solution, autoclaving or dry heat. Gutta percha is sterilized by, mainly you use a chemical solution, isn't it? Yes. Next, 39. Most recent form of MTA used as an intracanal irrigant. Most common recent form. MTA, the most recent form is MTA-D. Okay, which is used for intracanal irrigant. Okay. 40. The in-office non-vital bleaching technique is walking bleach method or power bleach method or thermocatalytic technique or night guard technique. So in-office non-vital bleaching technique is thermocatalytic technique, which is very effective method of bleaching. Question number 41. The confirmatory test for pulp vitality is a thermal test or test cavity, analytical technology, electrical pulp test or digital pulp radiography. For pulp vitality testing, you go for a test cavity as a confirmatory test. Okay. Question number 42. Rest everything is temporary, not confirmatory. Okay, only provisional. Question number 42. Which of the following instrument is used to locate the canal orifice? To locate the orifice top portion, you use a explorer. Okay, endodontic explorer. Question number 43. Narrowest part of zipping canal is known as minor diameter or major diameter or isthmus or an elbow. Narrowest part is called as a elbow. Okay. Question number 44. Apex locator with 0 reading means what? You have reached at the minor apical foramen or major apical foramen. Apex locator is giving you 0 means you have reached only the major apical foramen. Okay. Question number 45. Which of the following is associated with neutropenia? Which drug reduces the neutrophil count? Doxorubicin, vinblastine, ciaplastine, methotrexate. Methotrexate, definitely. It is given for cancer. Methotrexate will reduce the neutrophil count. Okay. Question number 46. General anesthetic most likely to cause bronchodilation is thiopentone, ketamine, propofol, fentanyl. The one which causes bronchodilation among the following anesthetic is ketamine. Ketamine will cause bronchodilation. Question number 47. The glucagon-like peptide, that is GLP-1 receptor agonist among the following. They are asking agonist. Okay. GLP, glucagon-like peptide 1 receptor agonist among the following is natiglinide, liraglutide, sitagliptin, saxagliptin. It is liraglutide. Okay, just by heart. Liraglutide. That's it. Question number 48. Which of these inhibits cell wall synthesis? Gentamicin, vancomycin, clindamycin, erythromycin. The one which inhibits cell wall synthesis is vancomycin. Okay. Question number 49. Which is a bactericidal antibiotic? Aminoglycoside, erythromycin, tetracycline, sulfonamide. The one which is acting as a bactericidal antibiotic is aminoglycoside. Okay, among the following. Question number 50. Beta blockers are contraindicated in which condition? Decompressed CHF, asthma, variant angina, all of the above. Beta blockers are contraindicated for asthmatic patients. It is contraindicated in case of a variant angina. It is contraindicated in case of a decompressed CHF also. So all of the above is the answer. Question number 51. The setting expansion of gypsum product can be reduced by increased spatulation method, adding potassium sulfate, less water powder ratio, allowing setting under water. So if you reduce any of the above, that is increase, if you do the increased spatulation also, if you do less water powder ratio also, allowing setting under water also, nothing will change. But you have to add potassium sulfate to reduce the setting expansion. Okay, so by adding potassium sulfate, you can reduce the setting expansion. Question number 52. Porosity of danger base is due to this. You have done in preclinics and you have seen the porosity. Whenever you put a less pressure, inadequate pressure, you get porosity. Okay. Question number 53. VLC resins are also called as microwave, tertiary amine, light activated, heat activated. VLC stands for light activated resins. Okay. Question number 54. Copper content in low copper amalgam is how much percentage? 6%, 12 to 13%, 29 or 19. They have asked low copper amalgam. So always go for the lower value, 6%. Okay. 55. In amalgam alloy which act as an oxygen scavenger? Copper, zinc, mercury or palladium. The one which act as an oxygen scavenger is zinc. Okay. In amalgam. 56. The concavity at the root of the nose is used as a third point of reference with Whipmax average access Facebook, Henaubo, Dentatus or Cavo. The concavity below the nose is used in case of a Facebook. Okay, option A. Question 57. S shape of the dental tubule is due to what? We have learned in first year in dental anatomy, crowding of odontoblast will create the S shape. Question number 58. Pericytes are found in pulp. Remember, pericytes are cells which are surrounding surrounding the capillaries of the pulp. Okay, so it is mainly seen in the pulp, around capillaries of the pulp. 59. Width of the periodont ligament is least at the cervical third, apical third, fulcrum of rotation, or it has uniform width. Width of the PDL is least in the rotation area, fulcrum of rotation area. Okay. Question number 60. Carmel glands are minor salivary gland, but the option B says it is the retromolar minor salivary gland. Option C is telling it is the lingual minor salivary gland. So we have to be careful whenever you mark. Okay, be careful. Carmel gland is a minor salivary gland. It is retromolar area. Okay. 61. Standard error of mean indicating what? Whenever you have a error of mean, standard error of mean, it indicates a deviation. Okay. Question number 62. Scatter diagram represents trend over time, pie chart, association between two variables, frequencies telling the occurrences. So, scatter diagram is telling you the association between two different variables. Okay. Question number 63. The number of new cases of a specific disease occurring in a defined population during a specific period of time. So they are telling new cases. New cases means incidence. Okay, option A. 64. Bias is any systemic error in the determination of association between what? Between a disease and its exposure, isn't it? So any determination, any error in the disease and its exposure. So option C. 65. The best sustaining topical effect of fluoride is obtained by. So the best fluoride material is Durafat. Okay. 66. Milk fluoridation was introduced by Knudsen, Bibby, Westby or Ziegler. Milk fluoridation by Ziegler. Okay, remember Ziegler. 67. Crippling fluorosis is characterized by blockage of blood vessel, chipping of the teeth or rigid spine calcification of blood vessel. You are getting enough amount of fluorosis. So crippling fluorosis is characterized by the spine is becoming rigid spine. Okay. Question number 68. Carry over effect is seen in case control study, concurrent parallel study, crossover study or panel study. It is seen in crossover study. Question number 69. Backwashing is a recommended technique for whenever you do a filtration at a very rapid rate, you have to do backwashing. Okay, so just remember that way. Rapid sand filter will give you backwashing is recommended. 70. Glycine is used for the synthesis of the following except is asked. Okay, so glycine is required for the synthesis of heme. Glycine is required for the synthesis of purine. Glycine is required for the synthesis of creatine. It is not required for serotonin. Option B. 71. Inhibition of glycolysis by oxygen is known as Muni effect, Pasteur effect, Hill reaction, gluconeogenesis. Inhibition of glycolysis by oxygen is called as Pasteur effect. Okay. The precursor of steroid is amino acid, fatty acid, cholesterol or none. Very easy question. Steroid is made from cholesterol. Okay, option C. Question number 73. Vitamin D. This same question we have dealt in a previous model paper in a different way they have asked. Okay, so the options are vitamin D absorption required bile acid, no. Synthesis is regulated with the reaction catalyzed by 15 hydroxylase, no. Deficiency on adult leads to rickets, no. Osteomalacia in adults and rickets in children actually. Along with parathyroid increase, there will be a calcium resorption also from the bone, which is correct. Whenever there is a vitamin D deficiency, there will be parathyroid hormone increase and there will be a calcium resorption from the bone. Okay. Question number 74. The most common enzyme deficient in man is very famous disorder G6PD deficiency syndrome. So the most common enzyme deficient in man is G6PD. Question number 75. Translation occurs in which organelle of the cell? Okay, mitochondria of the cell, centrosome of the cell, nucleus or ribosome. This we have learned in +2. Translation occurs at ribosome level. Okay. Now 76. IgG has subclasses. How many subclasses? IgG has got 4 subclasses. Okay. Question number 77. Is Borrelia vincenti is a mycoplasma or mycobacterium or spirochete or chlamydia? Borrelia vincenti causing the periodontal disease is actually a spirochete. Okay. 78. Negative staining is used to demonstrate what? Negative staining is always demonstrating a capsule. So, a bacterial capsule. 79. ASO test is used for the diagnosis of rheumatoid arthritis or typhoid fever, rheumatic fever or rickettsial fever. ASO test is used for the diagnosis of rheumatic fever. ASO test concerned with rheumatic fever. Okay. Question number 80. DPT vaccine is not contraindicated in progressive neurological disorder, severely immunocompromised patient, high allergic response to first dose, severe convulsions in a patient. DPT vaccine is not contraindicated even though you have immunocompromising. Okay. It is contraindicated if you have any neurological disorder, you have any allergic response, or if you have any convulsions. It is contraindicated. Okay. Question number 81. In periodontal disease, calculus is considered as calculus is actually a contributing factor in periodontal disease. Remember CC. Okay, contributing factor. Question number 82. Periodontal pockets which offer the least possibility for regeneration are classified as suprabony pocket, one-wall infrabony, two-wall infrabony, three-wall infrabony. Periodontal pockets which offer the least possibility for regeneration are one-wall infrabony pockets. Question number 83. Which one of the following ailment most commonly causes periodontal disorder? Hypophosphatemia, vaginous granulomatosis, multiple myeloma, AIDS. Okay, the one which causes periodontal disorder most common is a AIDS among the following option. Okay, you have to check the options and you have to select. Among the options, AIDS will have more amount of AIDS patients will have more periodontal disorders. Question number 84. Gingivectomy is contraindicated in gingival hyperplasia, suprabony defect, infrabony pocket, phenytoin induced gingival hyperplasia. Gingivectomy is contraindicated if you have infrabony pockets. Okay. Question number 85. Ideal thickness of a free gingival graft obtained from the palate is? How much graft you can obtain from the palate? Around maximum 1.5. Okay, so 1 to 1.5 mm. 86. Earliest clinical sign of gingivitis. It's definitely bleeding on probing. 87. Who gave the term ECC? ECC, the term was given by Davies. Okay, option A. 88. The ideal restoration following pulpotomy in a primary tooth. After doing pulpotomy, you have to definitely give a stainless steel crown. Okay, that is the ideal method for a pediatric patient. So, option D. Question number 89. Root completion in primary teeth is by the age of 1 to 3 years, 5 to 6 years, 3 to 4 years or 7 to 8 years. For a primary deciduous tooth, it takes around 3 to 4 years for completing the root, even after eruption of the tooth. Okay. So 90. All are disadvantages of ZOE except. So zinc oxide eugenol if pushed periapically will cause irritation in the tissue. Very true. It has poor antimicrobial property. No, it has very high antimicrobial property. Third one, rate of resorption is different from the two. That is correct. That statement is correct. May alter the path of eruption of succedaneous tooth. That is a disadvantage of zinc oxide eugenol. So the option which is not correct, okay, except it has poor antimicrobial activity. 91. Permanent mandibular central incisor develops from how many lobes? 4 lobes. Just by heart, 4 lobes. Question number 92. A child has got 12 permanent and 12 deciduous teeth. What is his age? So 12 permanent means which will be the permanent which will be present for the child. The first permanent tooth to erupt will be the molar. Then there will be exchange of the incisors. So you have 4 incisors in the top, and in mandible also you have the 4 incisor, to total 8. 4 molars, so altogether 12 permanent teeth. Okay, so the last tooth to erupt among the following permanent tooth to erupt will be the lateral incisor, which is around 8 to 8.5 years. So the age of the child will be 8.5 years. Okay. Now coming on to 93. Desmodont is another name for periodontal ligament. Easy question. 94. On opening the mouth, if jaw deviates to the right side, it indicates there is paralysis of the same side muscle. Okay, which side the mandible is deviating? To the same side, the muscle will be affected. So, right side means right lateral pterygoid or right medial pterygoid. The one which helps in opening the mouth is lateral pterygoid. So, right lateral pterygoid, there is a defect. Okay, question number 95. A patient shows inability to close the right corner of the mouth is most probably suffering from. So, this is a classical condition of Bell's palsy. Okay, not able to open the mouth, the right corner, not inability to close the right corner of the mouth. Okay. Question number 96. The characteristic alarm clock headache is sphenopalatine neuralgia. You have alarm clock headache. Question number 97. Bully caused by femphigus are seen mainly the femphigus affecting the women. Okay, so it's mostly seen in women. Question number 98. Which of the following is a painful ulcer? Syphilitic, tropic, oral chancre, or all of the above? The one which is very painful is, among the given option is a chancre. Okay. Question number 99. Role of Bucky diaphragm. Diaphragm is given in radiography to limit or remove the scattered radiations. So the option A is correct. Limit the amount of scattered radiation reaching the radiographic film. Not to increase the image contrast, not to absorb extra heat, not to protect the operator. Buckley's diaphragm is given to remove the scattered radiations. Last question. Okay, the most common cause of radio opacity over the apices of the molar in IUP. So whenever you take an IUP, even though the patient is not having any caries, you will see a radio opacity over the apex of the molar because it is actually a normal anatomy. You are seeing which region? Maxillary sinus? No. You're seeing a palatal bone? No. In the molar region, you are definitely dealing with zygoma, zygomatic process and zygoma of the maxilla. Okay, so we have marked all the 100 questions. Let's check whether all our answers are correct or is there any mistake we have made while marking the options. Okay, no, bingo. So we have marked all the 100 questions. We have got 100 points. Okay, so thank you, my dear students. So please do revise these questions and answers and watch the video thoroughly, repeatedly, and subscribe to the channel because more model papers are yet to come. Okay, thank you. Bye.